welcome back to What Did You Learn? My name is Ahava Leibtag, and I'm so excited to have my guest here today with us. Courtney Doyle has been a friend, colleague, and mentor. We were trying to figure out for how long, about 13, 14, 15 years. Courtney is the Director of Customer Development and Marketing at Sentara Healthcare. Courtney, thank you so much for being here.
Well, thank you, Ahava. It's great to see you. I haven't seen you in a while, and just thank you for having me on today. What a pleasure.
It's great to have you. So, Courtney, you're unusual for my guests in that you have a public office position. Can you tell our audience a little bit about your service?
Sure. In addition to working at Sentara Healthcare full-time, and I've been here 22 years, I also serve on Norfolk City Council. I was elected 2 years ago, so in May of 2018, and I represent Ward 2 of the city of Norfolk. And Norfolk's about 250,000 residents, and I've actually done quite a bit of community service over the years, and serving on city council has been wonderful. I really appreciate the honor to serve.
It's amazing. You should definitely follow Courtney on Instagram. She's always posting the most interesting things, and it's so cool to see the inner workings of something like that. You know, it's transparency that we don't see all the time, and I just really love that. So just to learn a little bit about you, what was your favorite comfort food during quarantine?
I would say there were these strawberry cookies that the local market was selling that I am not a sweet person at all, meaning I don't eat sweets. And so I just saw these and I buy them every time I go to that store.
I get it. I get it. Mine is Ben & Jerry's New York Super Fudge Chunk. I've eaten more than my share of it. And somebody told me that everybody's gained the COVID-19.
Yeah, I know.
Okay, and so if I had been talking to you, let's say in January of this year, which is about 7,000 years ago, I don't even know, and I had said to you, you know, Courtney, I want you to get ready for this thing that you just cannot believe is going to happen. What do you wish you had known?
There are probably two major things. One is the duration. I would have loved to have known how long. Now, we're still in it, so there is no answer to that yet. And the other thing is, I would love to have anticipated better the reaction of the community, of employees, of the general public of having to change their lives so significantly and being given the mandates to mask, social distance, hygiene, to see how people have reacted to that differently, whether they've adapted to it or resisted it, and then the impact either of those behaviors has had on our communities. I kind of wish I'd been able to anticipate that, because I think I would have maybe communicated or messaged our messaging a little bit differently, knowing that in advance, because now I feel like we're doing it in a reactive mode versus proactively advocating why it's all a good thing. Social distance, masking, limited crowd, et cetera, et cetera.
Right. So tell me, because it's fascinating that you have these two roles in your life. Did you find that having this extra insight into what was going on with the city council was helpful at Sentara and vice versa? It was.
Sentara is the largest healthcare provider in Virginia, and we work very closely with our governor and our state level folks. So I had a lot of insight based on working with the state and knowing what was likely to happen when the governor was going to come out and make change. And then working on the inside with Sentara, learning more about the clinical side of COVID and how we're treating patients and how we're helping employees be safe and about PPE and supply chain management. It was inordinate. I've kind of learned both sides of it, and they've been both very complementary.
Yeah, I'm sure. You know, one of the things I've always admired about you is your leadership skills. How did you galvanize your staff to just keep going? And then also with the Black Lives Matter movement happening, like right in the middle of all of this, what did you say to them? How did you keep tabs on how their mental health was? They were all working like overtime, like crazy.
They were working really hard. When this first hit in March, I marvel at the fact that the team basically worked 7 days a week for about 3.5 months. And I was very appreciative and still am for their dedication. And they were just committed to doing the right thing and being available and really doing what the company needed to better serve our patients and our communities. I think by literally doing this, I was on Zoom or WebEx, physically seeing them has made a huge difference. Being on the phone with somebody just doesn't do it. I think to be physically with them is important. And then secondly, there was a time, probably about maybe August, where we have this group team meeting, and everybody's on the screen, and they can bring their dog, pets, birds, cats, whatever they have, and literally for the 30 minutes of this one team meeting, I simply paused. I gave people an opportunity to talk, to say whatever they wanted, and it was right after the civil unrest and protests started happening, the Black Lives Matter, and we had protests here in Norfolk. They were very calm and peaceful, and so literally people just spoke as to how they felt. And literally there were tears on the call, literally. But silence was golden. I really pressed myself not to speak and to give people the chance to speak, so sometimes it was an uncomfortable silence, but that was okay, because then it made people comfortable to feel uncomfortable and to speak.
Yeah, no, absolutely. I mean, I always tell people that, part of being a good communicator is knowing when to shut up.
Yes, completely.
Just to listen, because that is communication, right? Speaking and listening. So, I do this thing where when I talk to my team members, I ask them, like, what's your mental health like? How are you doing? And I have found that most people are like, I'm doing okay. Like, they don't necessarily want to always share how they're feeling at that moment. In this group call, did you find that people were more willing because other people were sharing? Like, where did that come from? Was it such a vulnerable, raw time to begin with?
I think people felt comfortable because we're a very close group, and we had been through so much since the early part of COVID that there was a sense of intimacy together, even though we were on screen. And it was remarkable. After that meeting, there was one gentleman who spoke up and spoke about racism and how he had seen it when he was a young soul back in St. Louis. And that story resonated with so many people, and the way he delivered it, that afterwards he got so many emails from everybody on the call just saying, thank you so much for sharing. Don't feel bad for crying. I'm glad you shared that experience. This was my experience, or this is what I've learned. And so the conversation didn't even end then. It actually continued with people reaching out to this gentleman and speaking in support of his transparency.
Yeah, I think the first pickle out of the jar is the hardest, right? In other words, just to get people to talk, you just need that one thing. And I think people wanted to talk about it. They wanted to express how they were feeling. I think people felt so isolated and so alone by quarantine that this happened. And I think for the people who it really affected, it was so interesting to hear their stories, things that they had never told me before that they felt. I had a good friend who told me, she's Black, she's from Africa, and she told me that she's followed around stores, and she had never shared that with me before. I never do that, and I was shocked.
Wow.
So I think it was a valuable experience. It was a very painful experience to go through as a nation, I think. But I think that good things are going to come out of it. It's terrible that people had to lose their lives, but I do think that there's some value in what happened.
Absolutely. And we're still learning. We have a lot to learn.
A lot to learn. So let's go back to the pandemic, because you've been at Sentara for 22 years, and from what I have seen there, the CEO has been always very supportive of marketing and communications. Mm-hmm. How did you manage that? Talking to your staff, talking to the executives. How did that up and down communication happen? Were you in the command center? Were you getting things from the command center?
I was physically in our incident command center. There were 3 of us that rotated through, and I was one of the 3. And I today still sit in the ICC. We use it. I actually sit on the steering committee of the incident command center. And we meet every Wednesday at noon. And frankly, today we discussed having to extend our meetings longer than an hour because of the uptick in the numbers of COVID now, the hospitalizations, and then we have the vaccine on the horizon coming out. We have more antibody drugs coming out. So there's just more happening with COVID that we are realizing we're going to need to have more conversations. So yes, I was in ICC and I still am. And our CEO was actually not necessarily in the room every day. Our COO was, and our chief physician executive. So our next layer of folks were there. And our CEO actually came into ICC a fair amount just to sit in, listen, hear, or he would dial in. Because there were obviously very few people in the physical command center, and a lot of people dialed in. I was in the physical command center at the time. And so we did daily communication out to leadership. And what I've found and what I'm learning today is that we need to expand that communication to a broader net within our company, because now we're talking about things more than just the clinical treatment of COVID and the PPE. It's about returning to work potentially and the safety of that. And so that's not just about what's happening in our hospitals, but what happens in our business settings. So, we've learned a lot of what we've done well, but we can clearly continue improving.
Yeah. So how are you getting ready to brace yourselves? Like, are you going to continue doing elective procedures? Are you just waiting to find out what's going to happen? And what's that? There must be such anxiety around that. I know I feel the anxiety about what's going to happen next.
Well, in Virginia right now, we're at 6.1% positivity. We're one of the few states that's up seeing a huge spike. Now, the southwest part of the state right now, as of yesterday at least, was at a 9%. They're actually climbing, which is a concern. When the governor held his press conference yesterday, he highlighted that as a concern of his. So right now, we're still doing electives. We're carrying on the normal course of business as well as treating COVID patients.
So in terms of getting into that command center and talking to all these people and being on a steering committee, did you have the chance to sort of break down some silos that you felt previously?
Absolutely. The idea of a title kind of was non-existent. You just spoke to whomever you needed to get what you needed to get done, and you did it in the most direct, fast fashion possible. I've learned more about our company and supply chain management, materials management than I ever thought I would know. I know drug names that I never thought I would know. I never thought I'd understand the administration of a drug, or safety at our ambulatory outpatient settings. So really, it was about breaking down titles, hierarchy, to do what we needed to get done in a safe and efficient manner.
So what do you think the most important learning has been for you during this time period?
I would say how to adapt constantly, and that once you think you've changed enough, you still need to change and adapt, which I think is healthy anyway, to be perfectly honest.
Charles Darwin said, it is not the strongest of the species that survives, but the one that is most adaptable to change.
Yeah.
And it's really true. And I see that around me all the time, the people that have, given up that whole idea of like, this is how we've always done it. The people who have been flexible, the people who have said, listen, we need a telehealth program. We can't make it perfect. We've got to just stand it up now. And, we'll cross that bridge when we come to it. And those have been the ones that have been the most successful. Instead of waiting, that paralysis through analysis that I find sometimes has followed us through healthcare communications, it's not there as much anymore. And I'm hoping it'll sustain itself. But if I asked you, let's say in a year from now, I come down to Norfolk, you take me to one of your fun events, city council, what's the one thing you think that you will never give up in your practice, in leadership, in marketing and communications? What's going to stick with you no matter what?
I think going back to listening, honestly. I think listening to your client, your customer, your consumer, your employee, your provider. We've had to do that more and more now, and then use that information wisely to improve what we're doing. Because if you're tone deaf, you will fail.
So let me ask you a question about that, Courtney. Do you think that we used to listen because we thought we knew, but now that we're in this new place, we know nothing, so we listen better? Like, what do you think it is?
I think it's because, frankly, a lot of people are speaking up more as well, and they're not as afraid to speak up. And so when you're hearing something you're not expecting, you think, wow, I'm glad I stopped to hear that, versus assuming that person wasn't going to speak up at all.
Yeah, like my friend. Yeah, like exactly. Yeah. She never would have told me that before this happened. But I think because it happened, maybe sort of the shame around it went away. And I think that that's true. People feel empowered to say more, which is, I think, a really valuable thing for all of us, but especially in communications.
Yeah, absolutely.
Courtney, where can people find you?
Well, here at Sentara, I'm at crdoyle@sentara.com. email me, and I'm on email a lot, as you could imagine. I'm sure you are too. So that's where you can reach me here at Sentara.
Okay, awesome. And definitely follow Courtney on Instagram. It's great. She has the most adorable dog, and she's always just posting great pictures of what's going on in Norfolk. So she's super fun to follow. Courtney, thank you so much for being here and sharing your wisdom with our audience.
It has been great to see you. Thanks for inviting me. This has been really fun, so I appreciate the opportunity. This has been great. We have to do this, frankly, more often. I need to see you more often.
I would love that. Thank you.